The last year, you've no doubt heard the buzzwords of the Affordable Care Act.
Over the coming week, we'll go from broad to specific, from we to me, taking a closer look at what health care will look like in the coming year for you and your family.
Each day, we'll highlight a specific group impacted by the changes. East Tennessee hospitals, patients, insurance providers. Today, we're focusing on the doctors. And joining us for our conversation, Dr. Karen Gallagher, a Knoxville breast surgeon, and Dr. Mike McBride with Summit Medical Group. Thank you both for being here. We appreciate it. And Dr. McBride, let's start with you. And you've spent much of the last year educating other doctors about these changes. Let's talk a little bit about what you do before we get into how it's going to impact them.
Sure. It's my pleasure to serve as the medical director for quality and informatics at Summit Medical Group. That means I spend my day championing health care for folks, and also making sure that 300,000 patients that seek care at Summit facilities receive the best care they can.
And Dr. Gallagher, could you explain a little bit about your practice?
Absolutely. I'm a private practice solo practitioner. I'm a board-certified general surgeon, and I specialize in managing patients with breast cancer.
Okay, the Affordable Care Act. It is something that is mammoth, and we were talking about it during the break, Dr. McBride. It's something that you're trying to teach other doctors, obviously, how to handle. If there is one issue when it comes to the Affordable Care Act that is first and foremost, be it good, bad, or indifferent, what is that when it comes to what you do?
Probably the rate of change. Physicians are being asked to change a lot of the way we do things in healthcare, from how we deliver it, where we deliver it, and the rate of that change is almost overwhelming that physicians face.
Dr. Gallagher, can you speak to that personally?
I am the person. Things are changing very rapidly, and there's a lot of regulatory standards, especially for private practitioners, that are going to be critical linchpins in how we practice.
What are some of the specifics of that change?
Dr. McBride's specialty, the EHR mandates for having implemented electronic medical records by January 1st of next year. For my practice, which is a paper practice, I have paper medical records, but certainly have access to our hospitals' health information systems. It is a huge financial burden for my practice, 5 to 6 figure financial burden for me to set up an electronic medical records program. And for the specialists, there are not specialty programs, so that means revising the whole program to fit my particular need.
So we're not only talking about cost, though, but once it's implemented, I have to imagine the time that is dedicated to this is quite significant. Would it be?
I've not used the system in a private practice setting,
right.
But at the breast specialty meetings, some of the studies run are a little bit discouraging to me, because it sounds like it is not got much of a learning curve, that it increases your overall time required for charting purposes. However, Dr. McBride and I were talking beforehand, there are a lot of benefits to it, but right now it seems like a pretty daunting prospect for a practice like mine.
What are some of the benefits, Dr. McBride?
It is pretty overwhelming when you face it on your own. Our physicians, long before I ever joined Summit, dedicated themselves to implementing electronic health record systems and began that process almost 8 years ago. 3 years ago, I joined the group when they determined that it was time to move out of a pilot phase and into a full rollout. So over the course of the last 2.5, 3 years, we've gone from 28% electronic and 72% paper to 100% electronic practices. Some things that we're seeing is access and quality being two big things. We have facilities where patients can seek care after hours called express clinics. However, prior to going electronic, if you saw a Summit physician and then went to a Summit Express clinic, it was like seeing a whole other provider. They didn't have any greater access to your care than anyone else in the community might. Now they actually have appropriate access to treat patients. If you're seen in a Summit facility, you can actually have access to that same record at the Express clinic. And along those same lines, our community is working on solutions that will enable that same level of access if you present to the emergency room, for instance. So the emergency room physician could see your medication list, things you might be allergic to, and perhaps prevent harm. Above all else, do no harm. So some things that we dedicate ourselves to in healthcare, There are some things in electronic records that will enable us to do a better job of delivering healthcare, but there's no question that it places a huge burden on the practice and the physicians, their staff, to make that transition from paper to electronic.
We're going to take a quick break from our discussion, but as we do, we'd like to go to break with a perspective from another doctor who talked about electronic medical records. Let's listen to that, and we'll see you on the backside of this.
Well, my father is still practicing up in Scott County, family medicine, and he's been doing it for over 50 years. And needless to say, he's probably not going to be able to continue doing it with electronic records. As far as my training, as soon as I came to the residency here, we already had it implemented, fully run, fully functioning. But I've seen a lot of specialties, a lot of other physicians having issues trying to transition over to that.